Today we're going to talk about the reverse lunge. And the reverse lunge is a great movement to use in the warm-up. Particularly, it stretches out that front side of the body. Now, if we look from an overhead view, we should be covering that front foot with the thigh. So if we're looking down, we shouldn't be able to see that front foot at all. What we don't want is we don't want that foot or that thigh misaligned, right? We don't want that thigh and knee collapsing inward during the movement. The other key piece is to think about bracing hard in the abdominals, almost like you're getting punched in the gut. And that's going to prevent the back from arching. Another key piece to prevent that back from arching is not looking up with the eyes. And so all of this is allowing a deeper stretch of what's called the deep front line, or muscles like the psoas in particular, which is a very strong hip flexor, but also has some lateral rotation. And we don't want to be feeling it in the low back or the back side of the body or even in the lower leg, focusing on that psoas. And a lot of times we need this because we sit most of the day. And that sitting causes a tight hip flexor and ultimately low back pain because that psoas restricts the hip joint movement, which then pulls on the vertebrae of the low back. What that ends up doing to the pelvis is it tilts that pelvis forward, creates that low back arch or that anterior pelvic tilt, which shortens the muscles. And that shortened muscles makes us more likely for muscle strains, particularly when we run, like a hamstring. Because a shortened muscle plus the actual stretch of striding when you run starts to put that muscle at risk for tearing. And so the best way to do this movement is every day, usually about 3 reps, because each rep takes about 5 seconds or more if done correctly. And then as you progress, starting to add in a little bit of a lateral rotation to the movement to stretch that psoas further. Best used with athletes that have a low drive on a jump, on the jump scan. So athletes that have a low drive on the Sparta scan can benefit from this movement because if there's a longer psoas, there's also a longer ability to sustain force production, in movements such as a jump.